Hello everyone and welcome back to another anatomy tutorial. Today we will start dissecting the goat, starting with the head. So as you can see here, we removed already the skin and the facial cutaneous muscle completely, and even we cut some of the muscles to make sure we can see the other structures below the muscles. So let's start mentioning the muscles we can see in this view here. The first one we cut in this area here is this muscle here. This is the zygomatic muscle. Zygomatic muscle, as you can see, this is the start and the end of this muscle. The zygomatic muscle start or originate from the zygomatic arch there and moves all the way and inserts to the caudal angle of the mouth here, exactly to the orbicularis oris muscle in this area here. The zygomatic muscle is innervated by branches coming from the facial nerve, and here we can see part or one branch of this facial nerve, so we'll talk about it later. So again, this is the zygomatic muscle. The function of this muscle, of course, contraction of this muscle will move the caudal angle of the mouth here backward, and of course change, in the expressions of the face here in this area. The next muscle we are going to talk about is, in this case, this muscle here, which starts from the bones found in this area, the lacrimal bone, and in this area here, and inserts all the way down to the maxilla. This is the malaris muscle. This is the malaris muscle. The malaris muscle is developed here in the goats comparing to some of the other animals, like for example the canines and felines. This muscle, malaris muscle, is also innervated by a branch coming from the facial nerve. The next muscle we are going to talk about here in this case, and we can see here, is the levator labii superioris. The levator labii superioris. The origin of this muscle is from the maxilla somewhere there, and if you follow the tendon of this muscle, it will move all the way up here, meet the tendon from the muscle on the other side, and inserts to the upper lip, and that's why we name it as labii superioris. Superioris because we have another one down here, inferioris. And from the name levator labii superioris, we will understand that contraction of this muscle will elevate the upper lip upward. So this is here the levator labii superioris muscle. If we move down here, we can see the other muscle responsible to move the lower lip in this area. In this case here, this is the depressor labii inferioris. The depressor labii inferioris originates from the mandibular, that region here, and inserts to the lower lip. So from the name, contraction of this muscle will lower the lower lip or move it downward. That's why we name it as depressor labii inferioris. These two muscles are also innervated by the facial nerve or branches from the facial nerve. Another muscle we can see in this area here, this big one located in this area, this is the buccinator muscle. The buccinator muscle is very interesting muscle, of course, forming the wall of the cheek here, originates from the maxilla, inserts somehow to the mandible in this area, innervated by the facial nerve, and of course it's well developed here in small ruminants, the buccinator muscle. This one here, the buccinator muscle. So the other muscle we can see here in this area is the caninus muscle. So the caninus muscle originates also from the maxilla at that level here, and inserts to the Upper lip here in this area here, the level of the canine and other animals, and that's why it's we will name it as a caninus muscle. This is the caninus muscle. It's also innervated by branches from the facial nerve. Caninus muscle. If we move to this area here, we can see this round muscle here surrounding the mouth, opening completely on all the way left and right, called the orbicularis oris. The orbicularis oris, or the round muscle of the mouth, from the name orbicularis, it's surround the mouth opening, and of course contraction of this muscle will open and close the mouth, as you can understand here. This is the orbicularis oris, or the round muscle of the mouth. Here, of course, we removed, to be able to follow the branches of the facial vein. Here we remove the levator-nasolabialis muscle. If we move to this area here, we can see a very developed, very big masseter muscle. So this is all the masseter muscle here. The masseter muscle originates from the maxilla in this area, from the zygomatic arch in this area, and inserts to the mesenteric fossa of the mandible. So if we show now the skull of the goat, for example, you will see, or sheep, it's similar, you will see that the masseter muscle originates, as we said here, from the maxilla. Here. I hope we're still in focus. From the maxilla, and partially also from the beginning of the zygomatic arch there, and inserts to this fossa of the mandible. Called the mesenteric fossa. Again, to the mesenteric fossa, this here of the mandible, lateral side, lateral surface. Of course, if you think about the origin and insertion of the masseter muscle, you will understand that contraction of this muscle will bring the lower jaw toward the maxilla, toward the upper jaw. So that means this muscle is the main muscle and belongs to the mastication group, mastication muscle. The next muscle I would like to mention, this area here, that muscle there, called the temporal muscle. It's also another mastication muscle, very strong muscle, originates from the temporal fossa, which you can see in this area here. This is the temporal fossa. So this is the origin of the temporal muscle, and inserts to the coronoid process of the mandible. So this is the coronoid process of the mandible. I hope it's clear. So this is the mandible, of course, and this is the coronoid process. So if you consider the origin and insertion of this muscle from the temporal fossa to the coronoid process, so you will understand that contraction of this muscle will also move the lower mandible toward the maxilla, toward the skull, and that's why this is another very important mastication muscle in all other animals, and of course it's also like the same in ruminants. Temporal muscle. Now in this area here, what other muscles we can find here? So there is a muscle which surrounds the opening of the eye. Here in this area, we name it as the round muscle of the eye, or the orbicularis oculi. The orbicularis oculi, it's a round muscle, surround the eye here completely, originate at several levels from the orbital formation here, and inserts or surround the eye here. So contraction of this muscle will change the opening of the eye, lower and upper lid. In this view here, you can see this fat pad here, fat structure here, which is located just behind the eyeball here, and the main function of this fat is to protect the eye from behind. So where the location of this fat, again exactly behind the eyeball, behind the orbital cavity. So this is the orbital cavity here. Just in this area here, you will find this fat here to protect the eye from behind. We will remove it later to be able to see the muscles of the eye. Let's keep it in place now. Now I will move and talk about some other structures and organs. We can see here, starting with this one, this is the parotid gland. So the parotid gland is developed in ruminants. As you can see here, it's one of the salivary glands to produce saliva. And if you remember, we found the parotid duct, which transport the saliva from the parotid gland to the oral cavity, moving in carnivores over the masseter muscle. In small ruminants, even in cattle, for example, this is not the case. So you have to go down to be able to find the. So here you can find the parotid duct. Look how it comes from the parotid gland. So this duct moves all the way down, surrounding the masseter down here, and moves up and enter the oral cavity at this level here. So what is the name of this one here? This is the parotid duct, to transport the saliva from the parotid gland to the oral cavity. Let's put it in its place again. So it moves here. Here in this view, we can also find some other structures, mainly, for example, here, the very important facial nerve. So this is the facial nerve, which is actually the cranial nerve number 7, originate from the brain, of course, there. And after leaving the cranial cavity or the cranium, so it gives several branches to and innervates, the muscles of the face. And the two main branches we can find here is this one here and that one there. This is the two branches. The upper located one is the dorsal buccal nerve, or the dorsal buccal branch of the facial nerve, and this is here the ventral buccal branch of the facial nerve. So this is here the two branches of the facial nerve, here and there. Okay, so let's go back here, and so we talked about the parotid gland. If we move just a little bit down here, we will find another salivary glands in the depth there. I hope you can see it. So it starts actually even here. So this is the gland we are talking about now. So this is the mandibular gland. Can you see that? So this is the mandibular gland. Mandibular gland, it's a salivary gland located just under the mandible, left and right there. And it's also important to produce saliva, and the mandibular duct starts from there in the depth and moves forward to the oral cavity under the tongue. So what is the name of this gland? This is the mandibular gland. So it's not only this part, but it's also it's huge here, of course, comparing to other animals. So this is all the mandibular gland. Can you see that? So it's located more deeper than the parotid gland. In front of the mandibular gland here, we can see this structure, very nice. Here is the mandibular lymph node. It's normally located just under the mandible, in front of the mandibular gland there, just like this. This is here the mandibular lymph node. One of the lymph nodes, very important lymph nodes, located in the head. And this is one of the lymph nodes we have to check if we want to see if there's any problem related to the oral cavity or other structures of the head here. So what is the name of it? This is the mandibular lymph node. The mandibular lymph node here is not divided, so it's just one structure. If you remember, we talked about this in the carnivores, and we say that in carnivores, we have two of such, structure in this area here. So the mandibular lymph node in carnivores was divided. Here, it's not divided. Let's put it in place again. Sorry. So this is not the normal position. This is the normal position here. Just like this. Here, and at this level here, we can see the external jugular vein. It's empty, of course, here. The external jugular vein receives blood from two main veins. This is the first one, this is the second one. The first one here, it collects blood actually from the face and from the tongue region, and that's why we name it as linguofacial vein. So this is the linguofacial vein. If you dissect the linguofacial vein, you will find that it comes or be formed by two veins. The first one is this one here, is the facial vein. This is the facial vein, and the other one comes from the tongue region is the lingual vein. So facial nerve vein plus the lingual vein, both together they form the linguofacial vein, this one here, which meet with the maxillary vein. So this is the maxillary vein, collect blood from the rest of the head there. So the maxillary vein meet with the linguofacial vein to form the external jugular vein. This is the external jugular vein. What other structures we can find here? Of course, we need to say that here in small ruminants, you cannot find a facial artery moving next to the facial vein. This is not the case in small ruminants, but you can find the facial artery in all other animals, domestic animals. So here, there's only the facial vein, there's no facial artery next to it. So in this case, how this area will receive its blood supply actually through the other artery we can find here. It's cut at this level here. This is the transverse facial vein. The transverse facial artery. This one here, at this level here, moving over the masseter muscle, the transverse facial artery. Here, you may ask yourself, what is this here located on the masseter? It looks like a tendon. Yes, it's a tendon of a muscle which comes from the manubrium sterni. So that means it comes from the sternum and inserts to the head here to this area called the sternomandibular muscle. This is the sternomandibular muscle, which is absent, for example, in the carnivores. So here it's very clear, and this is the tendon of it. Sternomandibular muscle. Here, regarding the facial vein, you will see that the blood will be collected from the different parts of the head here, or the face, to form the fascia, or to the facial vein. So here we have the angular branch, which comes from the angle there. This one. Here we have the lateral nasal vein. Actually, we should have another vein here called the dorsal nasal vein. It's not, we cut it accidentally. Here we have the superior labial vein, comes from the upper lip, and we should have actually another one located down here called the inferior labial vein. Okay, so just to let you know that at this level here we have the larynx. This is the larynx here with some muscles inserts to the larynx. Behind the larynx on the trachea, this is the trachea. Now you can see here this structure here. This is the right thyroid lobe. So the thyroid gland is located just on the right side. Of course, we have one on the left side, on the trachea, behind or below the larynx. Here, just to mention that there is a muscle moves all the way over the larynx here called the omohyoid muscle. Omohyoid muscle, from the name, if you follow it, comes from the shoulder region and inserts to the hyoid bone. So from my side here, I can see the hyoid, the base hyoid there. So the insertion of the omohyoid muscle. Omohyoid muscle. Here at this level also we have we can see, for example, this muscle called the sternothyroid muscle. Sternothyroid muscle starts from the sternum to the thyroid cartilage of the larynx. So we will dissect them in details later, but just to mention, because we mentioned that the external jugular vein, I would like also to talk about some other deep structures found in that region there. Here we can see two structures: big artery. This is the common carotid artery. This is the common carotid artery to supply the head, and we will talk about the branches of it later. Next to the common carotid artery, here we can see this nerve which moves all the way next and adheres to the common carotid artery. This is the vagosympathetic nerve or vagosympathetic trunk. Yeah, so moves all the way next to the common carotid artery, vagosympathetic trunk. So that's everything for this area here. Of course, in this view, you cannot see the mylohyoid muscle, which I can see here extending between the two branches of the mandible. So I will try to show you later. And yeah, this is what we can talk about, the structures, muscles, and nerves and blood vessels of the head and the goat. See you in the next video.